Hi, I'm going to take you on a quick tour of the Health in the Investments Tracking Tool, our submission in the Social Detriments of Health Innovation Challenge. When we first thought about this challenge, we began to read a little bit more about the users and the challenges they were facing. And so whether they were federal, state, or local health officials, whether it was sort of those working in hospitals or health policy researchers, a story that we kept hearing was that they had limited resources available to them. And so there was a challenge to figure out sort of how to most efficiently apply those limited resources to have the maximum impact. And so what we wanted to do was put together a product that would help those doing that work target their efforts more efficiently so they can have a strong return on their innovation investments. And so what we developed is called the Health Investments Tracking Tool, the HITT. And the concept is that what we're going to use is that by using the social detriments of health, we're going to look at different sort of health outcomes and different sort of drivers of those outcomes and be looking across the country to find outliers. We're looking for counties that are overperforming expectations and those that are underperforming expectations. So we can sort of study those more carefully and look for where those who are overperforming what they're doing well, and also looking at those who are underperforming expectations, what can be resolved, might be some low-hanging fruit to address. It's also sort of helpful if we're going to be doing potential like testing new innovations, we can put together peer groups for those tests. And the way the system works is that it's similar to the concept of the outlier theory that was made fairly common through the Oakland Athletics from the Moneyball, where they used this sort of data identification of outliers to generate models for sort of players who were performing outside of expectations, either above or below the mean, and sort of modeling their team based on that. And that let them sort of compete with those who had higher resources by sort of having that kind of innovation. And so we've taken that innovation and applied it to sort of to health policy. What we have put together for the first phase of the challenge is we have sort of the concept. Additionally, we have some designs. We also went and we put together a functioning prototype with actual data for one of the social determinants of health. And we're going to go ahead and take a quick look at that right now. So what we're viewing is the economic determinants of the SDOHs. And in the system, in the prototype, you're able to sort of make adjustments of two sort of axes. On one axis is the health indicator. So this is the outcome. So if by default we have the county health rankings, but those could be different outcomes. So it could be obesity, life expectancy, diabetes. And on the other axis, we have the social indicator that's sort of driving those outcomes. So whether it's poverty rate, or unemployment rate, or education, these are what's going to sort of drive the health outcome. And what we're looking for is comparisons that sort of make sense. So we would expect, for example, where there's areas of lower education, there might be higher incidence of diabetes, or there's higher instances of poverty, it might be higher rates of obesity. So some of these comparisons are going to be expected and some will be surprising. And the users can go through and sort of play with all these different data sets and look for sort of this comparison. For the case of this demonstration, we're using the poverty rate against county health rankings. So the expectation is that as poverty rate increases, those health outcomes get worse. And so what the system does is it plots all the counties across the mean, and that's viewable on sort of a chart view or a map view. And then you're able to go in and sort of identify the outliers. So you can see any county and sort of where they fall in the mean, so you can see their poverty rate and their expected ranking, and then the actual ranking and how far they deviate. And then those who are sort of outperforming expectations, those are in the blue and above the fold here. And then those who are underperforming expectations, those outliers appear below the fold. You can also sort of over on the right scroll through any of the outliers, whether those are overperforming or underperforming, to sort of identify who you want to be looking at. It's still a lot of data, so there's some filtering built in, so you could filter by region or population size, or in this case we could say just show us all the counties by Texas. You can also adjust the outlier threshold. So that's going to change like how far from the mean something is determining it's going to be an outlier. And so as you go through different data sets, you're looking for these sort of outliers you want to be studying more closely. Maybe you want to find those who are right on the mean for a control group, but you're putting together those counties who you want to then look at more in-depthly. And you can just check those boxes as you go through and look at different data pieces, and it sort of adds those to your shopping cart. So it's building your list of counties that you're going to want to be studying, and you can export that later. So then you can take that list of counties, you can look sort of what's doing well, what's not working, and do the work that all these health officials do, but do it in a more targeted, more efficient way. So they're really kind of maximizing those limited resources that they have. So that's the phase one version of the product. In the next, if we get to the second phase, the goal would be to bring on several different data sets that we're looking at. So we would support all of the 5 SDOHs, additionally apply the designs that we've already done, and some other UX improvements. So thank you for your time and your consideration.